Hi, I'm Annie Caldwell, and I want to thank you for tuning in today and thank the organizers for inviting me to present to you today to talk about the importance of identity in long-term behavior change. And we're going to focus on changes in diet and physical activity, but there's much that translates to other health behaviors as well. And this talk is centered around answering the following three questions. Why does most behavior change fail? What needs to happen for behavior change to be sustained? And what key studies are needed to make progress in this area? So we'll start with this first one. Why does most behavior change fail? And the obvious answer is that it's too hard not to eat too much in our environment. So many easily accessible foods are calorie dense and nutrient poor and delicious and beautiful. And it's too easy to not move around enough. We don't even have to go through a drive-through anymore. We can actually just sit on our couch and order fast food from an app, and somebody else will drive it to us. And so given those things about our environment and moving into the nuance of things, really, the less obvious answer as a health psychologist is that traditional behavior change techniques come from social cognitive frameworks. And those frameworks assume that behavior is based on rational, conscious decision-making. The techniques that lead to successful behavior adoption might not be those that help with sustaining those behaviors over the long term. And we need to start looking outside of those frameworks and adding to them. So increasingly, health psychologists are using what is called dual process theories of mind, which understand behavior as not just being guided by reason and rational thought, but rather the interplay of these automatic and impulsive, reflexive cognitive processes and these controlled and reflective processes. And this is in line with Daniel Kahneman's work on thinking fast versus thinking slow. So we've got this system 1, fast, unconscious, automatic, and system 2, slow, conscious, effortful ways of thinking. But this emphasis and kind of recognition of these non-conscious factors that affect behavior are not really reflected in the techniques that we use to help people change behavior. So the most successful behavior change techniques that work for changing physical activity and diet in adults with overweight and obesity are setting goals, and not just for the outcome, but for the behavior as well, and then monitoring progress towards those goals. And these approaches really do work, keeping logs and setting these goals. But both require what are called self-regulation and self-control. So basically just controlling your behavior to act in goal-oriented ways, despite what your kind of automatic impulsive responses would be. And both of these require successfully recruiting executive function. And so what is executive function? Just briefly, it's a set of overlapping cognitive processes that allow for acting in goal-oriented ways. So inhibiting these dominant prepotent responses, attending to the right things that you're supposed to, and using working memory to make plans and execute behaviors that are goal-oriented. But there are difficulties with relying on self-regulation and self-control and executive function over the long term because, as we said before, it's slow and effortful, but it's error error-prone because it can be affected by mood, individual variability, energy level, tempting stimuli, which we have a lot of in our environment, also stress, which has become really relevant during the COVID-19 pandemic. Also, emotion and emotion regulation uses overlapping brain areas. And so needing those parts of your brain for emotion regulation can interfere with your ability to successfully recruit executive function. And in situations that are novel, complex, and threatening, we tend to just refer back to our habitual ways of acting and not be able to act in these goal-oriented ways. And so what is needed instead then to make behavior changes sustainable? And the short answer is a healthy behavior needs to become less effortful to output over time. And so a lot of work, recent work has shown that, we can do things to create automaticity in order to make behaviors less effortful. I'm sure Wendy gave a great presentation on this, but you want to repeat the behavior in stable, predictable context, maybe attach it to an existing habit, create an environment that makes it really easy to do the behavior using choice architecture and visible cues. And these approaches are great, especially for behavior adoption, but I would argue that for long-term maintenance, because you're going to have to then do the behavior in many different environments that are out of your control and under a variety of states, we need other approaches that can, kind of scaffold these approaches. In addition, temporal self-regulation theory argues that the extent to which a behavior can become automatized depends not just on this top-down processing, but the competing neural drives that are fighting against that top-down processing that is needed. So fear, fatigue, and hunger. So when we're talking about physical activity and diet, we do have these competing neural drives that are interfering with our ability to make those behaviors automatic, in contrast to something like putting on a seatbelt. And many others have noted that when behaviors are complex and they take a planning stage and then an execution stage, like the physical activity, they're difficult to automatize. So there is some difficulty here with these behaviors that make them more difficult to become less effortful. And so we need to consider other psychological factors that are important for sustainable behavior change that are modifiable and help make behavior more of a reflexive than a reflective and controlled process. It might not ever become fully automatic, but can we help make it become more the reflexive response? And so two of the leading candidates here are habit and identity. And we've already talked about some of the difficulties with habit. So I'm going to switch gears now and talk instead about why identity might be a factor that helps lead to more, less effortful cognition in order to output healthy behaviors. So from a theoretical perspective, identity comes with standards of behavior that we all understand are associated with a sense of self or a sense of identity. And we are motivated, to act in ways that are in line with our identity and those standards of behavior. And that creates positive affect when we act in those ways. In contrast, when we act in ways that are out of line with the behavior, it can cause negative affect and make you motivated to behave in ways that feel in line with your identity. And so if you're adopting a new behavior that feels in line with your identity, that's great. But if you're trying to adopt a behavior and it feels out of line with how you see yourself, you're actually going to be unconsciously motivated to go back and behave in ways that feel more in line with your identity. But in addition, as I mentioned, negative affect can also interfere with your ability to successfully recruit executive function and self-regulate your behavior over time. And so it's a double whammy there. In addition, a recent systematic review of 100 theoretical models on maintaining behavior change reviewed 100 different models, but 5 themes really emerged from those, and they're highlighted in orange. So you can see here that identity is thought of in most of these models as a part of motivation. From an empirical perspective, a growing body of research has demonstrated that health behaviors are associated with self-identity. So do I consider myself someone who does X, Y, and Z, or is doing X, Y, and Z part of how I see myself? There's, like I said, a growing body of research that is showing that it is, especially with regards to physical activity and exercise. food choices and smoking cessation, but other aspects of our identity have also been associated with health behaviors, like masculinity is associated with drinking, especially problem drinking, and really relevant to all of us right now, political party affiliation and social identity have been associated with mask wearing and vaccination. And then identity in a more complex way that hopefully I'll get into at the end, if I have time, is also been shown to be associated with diabetes management behaviors. So I can refer you to all of those example articles that have found a positive association there, but I think this meme pretty perfectly characterizes the relationship between identity and food choices and exercise, though albeit some extreme examples. In addition, a recurrent theme in health psychology is that these social cognitive models recognize intentions to do a behavior as the most proximate predictor of actually doing the behavior. But there's a widely recognized gap between what people intend to do and what they actually do. You can probably relate to that. And so a recent systematic review is just looking at factors that have shown evidence to moderate that relationship. And exercise identity within the domain of physical activity and exercise. And exercise identity in 5 out of the 7 studies where it was included did moderate the relationship. And so those that were higher in exercise identity were more likely to follow through with those intentions to exercise than those who had a lower exercise identity. But I would be remiss to not mention that most of these studies, all of these highlighted here, were done in college samples, and they're done in prospective studies that are not really looking at people that are interested in behavior change or going through the behavior change process. So that's a methodological shortcoming of the research that's been done in this area so far. Moving back to the theoretical piece, though, of where identity fits within the way that we think about behavior change, my colleagues and I developed the Maintain It model of behavior change and maintenance. And it's really trying to just build on and extend existing theories and approaches, especially those dual process theories. But it also defines a process underlying a shift from behavior initiation to behavior maintenance. With that underlying premise that effortful control to adopt these healthy behaviors needs to be reduced over time, and that identity transformation can actually help reduce the need for effortful control over time, and that behaviors that are adopted in ways that reinforce central aspects of identity will be more likely to be maintained. So the Maintain It model is different from other models that have included identity thus far because we suggest that it can create these cognitive shortcuts because people attend to self-relevant information more than non-relevant information, and they process self-relevant information more quickly than non-relevant information. And so we suggest that integrating behavior with identity also can lead to less effortful processing over time because you can create associative networks, increased attention, and more efficient processing when behavior is thought of as in line with identity. So what studies are needed to better understand this? First and foremost, we need more prospective studies in the target population during the behavior change process. So college samples are great, but there are only a handful of studies that have looked at the relationship between identity and behavior over time in that target population. And then in those studies, there really aren't any that are measuring behavior objectively. And we all know that people are not great at self-reporting physical activity and diet behavior. And so doing that will help us better understand what the relationships are between identity and behavior over time during behavior change, to know if it's a modifiable psychological target. And then if so, are changes in identity actually associated with more sustained behavior change? How does that relationship change over time? Does it change over time? And then the ultimate goal of this all would be to help develop and test intervention approaches that target shifts in identity if the evidence suggests that it is important in prospective randomized trial, the way that we have with these social cognitive variables. And so toward that end, my colleagues and I have been working toward that within a randomized controlled weight loss trial, the daily restriction and intermittent fasting trial. The PI is Vicky Catenacci, my primary mentor. And so this is a study in healthy adults with overweight or obesity that are sedentary at baseline. And the intervention is a 1-year RD taught group-based behavioral support intervention, targeting a 34% energy deficit based on baseline energy needs, with a prescription to gradually increase physical activity to 300 minutes per week by 6 months, and then continue that level for the rest of the intervention. And then folks are randomized onto how they're going to reach that energy deficit by either daily caloric restriction or intermittent fasting. And this timeline below shows you that the intervention is 12 months, and we've got measures of behavior and a bunch of psychological variables at all of these different time points, those black lines. And then there's also a 18-month follow-up phase. And so we also got a competitive revision grant from the Science of Behavior Change Common Fund to add measures of executive function and identity within the context of this trial to test the hypotheses that executive function will predict short-term physical activity and diet behavior in this intervention, but identity will predict long-term behavior, and that the combination of executive function and identity will jointly predict behavior at all time points, but identity will start explaining increasing amounts of variance over the long term. And so that's what we're working toward. But for today, I have some very preliminary results on identity using just a 4-item scale for exercise and healthy eating, where the scores can range from -3, not an exerciser, to +3, definitely an exerciser. Physical activity is measured with active pal accelerometers, which give us total number of steps, minutes per day in physical activity overall, and then minutes of the day in moderate to vigorous physical activity. And then for eating behavior, we've got the 3-factor eating questionnaire, which has 3 subscales: cognitive restraint, unrestrained eating, and emotional eating. So on the next several slides, I'm going to be sharing some preliminary unpublished data, but it is subject to change following peer review, and we're still waiting on the following data. So it is preliminary. We've got 1 more cohort finishing the intervention right now, or actually going into kind of middle intervention. We will have longer term follow-up eventually. We'll have objective energy intake, and then we'll have executive function, but all of that data takes longer to process. So given that, I want you to just keep this between us and not take any photos or share these results on social media until it has gone through that peer review process. And so at this point, we have data from 109 people from baseline to 12 months for objective physical activity. And we used a random intercept linear mixed model with an unstructured covariance matrix to assess the longitudinal relationship between exercise identity and total number of steps. And so what you're seeing now is the relationship at each of those time points: month 0, month 3, month 6, and 12. And what we found was that the relationship between these 2 variables did not vary significantly over time. And then averaged across those time points, 1 unit higher exercise identity score was associated with 623 more steps per day. And that pattern was also reflected in the total number of physical activity. And so 1 point higher on the exercise identity scale was associated with 6 more minutes of physical activity overall, and about 4 more minutes of moderate to vigorous physical activity. And we saw the same pattern for a higher healthy eating identity being associated with a higher use of cognitive restraint and lower unrestrained eating. And so another problem with this literature is how to define behavior adoption and behavior maintenance. And so we dug a little deeper into the way these variables change over time. And with your eye, you can see that with regards to physical activity and exercise identity, these are all increasing over time. But the biggest jump is really happening here between month 0 and month 3 in all of these variables, which, we all kind of assume is the a priori time. The behavior adoption is right at the beginning of the intervention, but we see it here with the data. And then to take it a step further, we also tested this change point model using 500 bootstrapped samples. And we saw that in 76% of those models, the best model was the one with the change point at between 0 and 3 months. And indeed, the slope of change is significant in the sample overall at that time point between 0 and 3 months, but not. And that same pattern of results was found for behavior-based exercise identity. So there's a significant slope from 0 to 3 months, but not after that. And then here we categorized people based on if your score was, you know what, I don't think I'm going to have time for this one. We'll come back to it if I do, but what other studies are needed? Another question that really interests me is that can we change behavior in ways that become incorporated into how one sees themselves, and does doing so improve long-term maintenance, again, with that end goal of developing intervention approaches to facilitate this. And so we asked the folks in DRIFT at 12 months, did the changes you made in physical activity become incorporated into your identity and how you see yourself? And indeed, over half of the sample said that it was, even though this intervention was not designed to do that. It was just an obesity guidelines-based intervention. But in 44% of the people, they didn't. And so we compared those two groups on these physical activity variables, and we saw that actually there were no differences between those two groups at baseline. However, there was significantly higher number of steps per day in those that said, yes, I have incorporated physical activity into how I see myself, as well as moderate to vigorous physical activity, on the order of 1,700 steps on average at 12 months and 15 minutes of moderate to vigorous physical activity. And it was also significantly different change in total number of steps and total physical activity overall. So these are just some preliminary results, but they're fairly promising. And then I also work on a 5-site international weight control registry project, where we're trying to extend the national weight control registry by including not just those who are successful at maintaining weight loss, but a sample of people that have also lost weight and regained it, or were unsuccessful losing the weight in the first place. And then measuring more constructs that might be related to weight loss. And so to date, we have over 1,400 people that have completed all those questionnaires. And I looked at differences in people that were successful at maintaining weight loss over the long term. And they have significantly higher healthy eater identity and exerciser identity than those that identify as someone that's regained the weight that they lost, or were never successful at weight loss in the first place. And so another thing is that so far the low-hanging fruit research is being done. So the behavior-based identity is just one piece of identity, but we really need to know how to incorporate all aspects of identity. So cultural identity, group identity, also, and how to take those things into account when helping people change behavior. There have been several attempts to culturally adapt interventions, but so far we're not really sure what the best ways are to do that. But I think that's in line with what we're trying to do here, and that behavior change doesn't happen in a vacuum, and people come in and they leave with an entire life and existence and sense of self, and groups that are important to them that are going to influence the extent to which they can actually maintain those behavior changes over time. And I just want to leave you with one final anecdote. A Facebook post from a member of a group I belong to. She left this post, and I thought there was just so much here that was relevant. So she said, "I'm completely overwhelmed with joy right now. Instead of yoga, I tried Zumba. I loved every piece of it, blah, 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 blah. This is the feeling of joy I remember. This is who I am. I used to dance all the time in my 10 years of college, and that dropped off dramatically after I finished my PhD, got married, and took a tenure track job. I moved on to other more appropriate types of physical activity, running, biking, swimming, etc. I didn't realize until this morning how much I miss everything about dance, moving my body in that way, the music, the energy. I'm so excited to do more Zumba. Maybe I'll seek out some other dance classes too." So I think we can all guess that she's going to keep doing that physical activity where those appropriate types that, were in line with her identity, but her identity as a PhD professor, maybe we're not in line with those other parts of her identity that are a dancer. And so how can we start incorporating more of this into our behavior change techniques so that those changes can be maintained over the long term? And I just want to end by saying thank you to all of these people. I hope I didn't leave anyone off, and I look forward to the panel discussion. Thanks so much.